Good morning and welcome to Medicare Made Simple with Medicare Myriam. Medicare Made Simple is brought to you by United Insurance Experts. Call today 561-464-CARE. That's 561-464-CARE. Now here's Medicare Myriam.
Good morning, everyone, and thank you for tuning in. I'm your host, Miriam Leyva with United Insurance Experts. United Insurance Experts is not affiliated with or endorsed by the government or the federal Medicare program. We do not offer every plan available in your area. Currently in Palm Beach County, we represent 10 organizations which offer 49 products. Please contact Medicare at 1-800-MEDICARE, or you can contact them online at medicare.gov to get information on all of your options. The purpose of this show is to educate you on Medicare and to connect you with valuable resources. Today, I will be strictly talking about Medicare as my resource guide is out today. So I decided I'm going to educate all on the new changes coming up this 2025 for Medicare. So one of the biggest things that are taking place in 2025 is the Part D, the prescription drug plans. There's going to be a major change, and that's what I'm going to be talking to you all about. There's going to be a cap, and this is the annual cap for 2025. It's going to be $2,000. So just to refresher for those that don't know how prescription drug works this year, there is 4 phases, right? You have the deductible, initial, the coverage gap, which is also known as the donut hole, and the catastrophic cap, which is $8,000. And that's for this year. This is for 2024. So for 2025, that cap is going to be $2,000. So you see right there, it's a major, major change, and it's going to benefit many Medicare recipients, especially those that take expensive medications. So the newly established standard Part D benefit design includes 3 phases, right? Remember, in 2024, there was 4. Now for the new year, there's going to be 3. The annual deductible, right? That's your first stage. Then you have the initial coverage and then the catastrophic coverage. So additionally, it features a reduced annual out-of-pocket threshold of $2,000. Okay, so let's go over this. The first phase, annual deductible. The beneficiary pays 100% of their gross covered prescription drug cost until the deductible is met. Now, this only applies if the plan that you have has a deductible. Now, that new deductible, now this is the maximum deductible for 2025. It's going to be $590. So if your plan, right, if you have a specific plan that has a $590 deductible, that has to be met first at 100%. Then the second phase is the initial coverage. Now, this is when the beneficiary pays 25% coinsurance for approved Part D medications, with the insurance company usually covering 65% of the cost for specific drugs and 75% for all other included Part D medications. That's why it's so important that when you do select a Part D plan or a Medicare Advantage plan for the new year, that you look at your medications and see what that cost is going to be for the new year. So this phase ends once the enrollee has met the yearly threshold of $2,000. And this is for the new year, guys, for 2025. The effective date is January 1st, 2025. Then you go into the catastrophic phase. This is the third phase. The enrollee pays no cost sharing for Part D drugs. So these are only for medications that are covered through your plan. You can't include medications that you pay out of pocket. So these are only for medications that are covered through your plan. So once you meet that threshold, then you don't have any pocket cost for the rest of the year, and then it starts again for the following year. Now for 2026, I don't know if this is going to be the same. It could change, but we'll find out later in 2025. So again, the $2,000 cap is expected to help save money for certain Medicare beneficiaries, especially for those that require these costly medications. So there's going to be many people that are going to benefit from this new change. Now, keep in mind that this change applies only, again, to medications covered by your Part D plan and does not apply to out-of-pocket spending on Medicare Part B drugs. You see, there are a lot of medications that are not prescribed, right? You get them from the doctor's office or they're administered at the doctor's office. So these drugs are actually covered through Part B of Medicare and not Part D, right? Part D is only when you physically go and pick up, right, your prescriptions, or a lot of times the doctor's office has a pharmacy in-house and they're actually getting that prescription for you. But the medications that are applied at the doctor's office, and an example like chemotherapy drugs or these shots that we get for osteoporosis, a lot of times are covered through Part B, and it does not apply to the Part D $2,000 threshold, okay? So make sure and vaccinations are also covered through Part B. That's another example, or outpatient prescription medications does not apply to the prescription drug plans, okay? Now, for those using a Part D drug, one of the things that I extremely recommend is reviewing your options carefully. So you need to ensure that your prescriptions are included in the plan. So please seek assistance, especially this annual election period coming up, because there's major changes. I don't know, you have to make sure your medications are covered, that you are going to pay the best price for your medications, okay, especially with these new changes. So when do we do this? We do this during the annual election period, which runs from October 15th through December 7th. So this is that time is built for you to make these changes. And sometimes you don't even have to do a change. You're not forced to do a change. Just get yourself educated with the new plans coming for the 2025 year. There's many ways you can do this. My advice is always to seek a licensed professional to get all your information, especially those brokers that represent multiple carriers. You could, I'm a big advocate of Medicare.gov. You can get information there. But again, it's best to seek assistance from a professional in the field. You're always welcome to call United Insurance Experts at 561-464-2273. That's what we do. We're here to help. And again, there is no cost for this. There shouldn't be an agent out there charging you for these services. Okay? Once again, no agent should be charging you to review your medications, to give you advice on which one is the best one for you. They get paid from the carriers that you enroll in, if you enroll, and there's never an obligation for you to enroll. You're supposed to be seeking help from an individual and get their expertise at no cost to you. It comes from the carrier themselves that pay these professionals. So again, it's so important for you to understand, especially again for this new year, what's the cost for your medications, right? So another thing, just because I see this a lot, there's a lot of people using these GoodRx, using all these great discount programs, which is great. But for the new year, you got to think, what happens if you actually use your plan, right? If it covers, let's say, something or has some coverage towards that medication, it might benefit you to run it through the plan for the new year instead of using the discount programs. Because when you use a discount program, it's not running through your plan itself. So you'll never meet that threshold. You might benefit using your Part D instead of using a discount plan. Okay, so keep that in mind. That is extremely important that you understand. So again, understand your options, understand this new Part D phases, right? The deductible, the initial, and then the catastrophic. If you need any help understanding, please contact us at 561-464-2273. Now that concludes my education on prescription drug plans. I do want to go over the questions that I received this week. And I thank you, everyone for, calling me and letting me know what their questions are if they have questions. And I really appreciate all of you. One of the questions that I got is, I live in Palm Beach County. Can I enroll in an Advantage plan today? So it all depends. It all depends if you're eligible for a special election period, right? Some examples of qualifying events are if you moved from a service area. So let's say you moved from Broward County and now you're new to Palm Beach County and your plan is not in the service area, that will give you a special election period to switch. So if that's your case, yes, you can do that. There's other special election periods, sometimes divorce, sometimes if you lost Medicaid, or maybe you're coming off a group plan. A lot of people don't know that you can come off a group plan right now and get that special election period so you can get on Medicare. So you don't really have to wait for AEP, which is the annual election period, to make a change, as long as you're eligible for a special election period. And a lot of times it's because you're losing credible coverage that they'll allow you to jump on Medicare. So you don't have to wait for the annual election period or the general election period at times. It all depends on your situation. But yes, coming off a group plan will allow you to jump on a Medicare Advantage or to jump to original Medicare, whatever is that you want to do, right? Other things are like if there is a special election period due to disaster or other emergency declared by the federal, state, or local government. Again, you do have to provide proof that you live or lived in the impacted area. So again, if you want to know more about special election periods, you could contact Medicare.gov directly if you'd like, or you can call us at 561-464-2273, and we could see if you're eligible for a special election period. So just get your education. If you are on, Medicaid now, or you want to come off a group plan, let us know. Let's compare, right? I always tell people, let's compare what you have to Medicare, okay? My second question that I received is, how do I know what my Medicare Advantage has to offer? Okay, so if you're already enrolled in a Medicare Advantage plan, you should know what you have. I am big on this, especially on a Medicare Advantage plan. Before enrolling in this plan, you better know everything, what it has to offer, right? What are your coverage options? Is it a PPO? Is it an HMO? Is it giving you these extra perks that a lot of people benefit from, right? Like the over-the-counter credits, dental, vision, gym membership. There's different, all depends on the plan itself, what it offers. So when you enroll in these plans, you should already know there's something that either the agent that helped you, or if you went directly with the carrier, they should have provided you with a summary of benefits and the evidence of coverage. The evidence of coverage is like the Bible, you could say, right? That's like the main thing, but it's like 300 pages. So you might want to look at the summary of benefits, and then if it's something in detail, look at the evidence of coverage. If you don't have it, right, and you just want to know what your plan offers, if you have your card, you can call the back of your card and call them up directly. All these plan providers have a member number that you can call, like customer service. And you can call them directly, and they'll be more than happy to give you this information. If we are your agents, and for any reason you lost it or don't have it anymore, whatever the story is, give us a call. We'll provide you another one if we are your agents. Or if you're already working with an agent, you can call them, and they should be able to provide you a digital copy via email right away, or they can order you one directly through the carrier if that's the case, okay? So again, it's so important that you understand, especially before enrolling, what that Medicare Advantage plan is offering you, because that determines which one's the best one for you. So again, if you want to know more about this, you're welcome to call us directly or contact the agent that you're working with. The next question is, should I be concerned because I'm in a Medicare Advantage plan? Should you be concerned? No. I'm thinking there was a reason why you selected the Medicare Advantage plan to begin with. Now, there is nothing wrong with Medicare Advantage plans. Our company represents both Medicare supplements and Medicare Advantage plans. There's nothing wrong. By law, Medicare Advantage plans have to give you everything that original Medicare has to offer, right? So Part A and Part B are offered through the Medicare Advantage plans, right? They just work differently. And that's why it's so important that you understand how it works, right? One of the biggest, you could say, limitations would be the networks, right? Because when you go to a Medicare Advantage plan, you're following networks. Depending if you're in an HMO, you're definitely limited, right? Because you can only see providers within the network. If you go to a PPO plan, right, you have more freedom. You're allowed to go out of network if you choose to for a higher cost, right? You got to pay a little more if you want that freedom. So it just depends on one, what you have, two, again, by law, they have to give you everything that original Medicare gives you. It's just different. And also these Medicare Advantage plans offer these extra perks like the dental, like the vision. They also include prescription drug. Most of them do, not all. These prescription drugs integrated within the plan, right? You have A, B, and D, and then these extra benefits like the dental, the vision, the gym. Okay. So that's probably why there's a lot of the clients that I put on a Medicare Advantage plan is because they benefit from these extra benefits that the Medicare Advantage plans offer. But if you would like us to review it, please give us a call, 561-464-2273. Next question is, which is the best Medicare supplement plan? Now, supplement plans are great, right? Because they work in conjunction with original Medicare, right? You have your red, white, and blue card, Part A and Part B, and then you have a supplement. So the best supplement today, and I'm saying best because it has the most coverage, is Plan G. Okay, so Plan G is the one that covers pretty much that whole 20% after you meet a small deductible of $240. Now, this is for this year, 2024. That deductible is $240. That can change for next year. I have not been advised of a change yet, but based on history, it does change. So we will know in the coming months what that change will be. And definitely the moment I find out, I will be letting you guys know. But as of right now, Plan G is the best supplement out there as it's giving you the most coverage. Now, there are other options out there like Plan N. There's also high deductible G. It all depends on you, because what happens is most of these supplement plans have a premium, right? So again, it just depends on what your needs are and what you're looking for. But yes, to answer your questions, the best Medicare supplement plan today is Plan G. It used to be Plan F. I still get people saying, I want Plan F. You could only get Plan F if you turned 65 or eligible for Medicare prior to 2020. That's the only way you can purchase a Plan F today. But again, the differences between Plan F and Plan G is only $240 difference. A lot of times, even though my client is eligible for a Plan F, I will put them up in a Plan G if it makes sense mathematically, right? There's no point of paying way more for Plan F if you can get Plan G and you're actually saving money. The only thing you have to take care of is that $240 deductible for this year. That same individual asked, which is the best Medicare Advantage plan? So there's many to choose from. With these Medicare Advantage plans, there is no, this is the best one. There's no such thing. It depends on you. That determines which one's the best one. A lot of times I have a husband where I will put with company A and the wife might get company B. Why? Because they both have different needs. They're both taking different medications. Sometimes they're both with different doctors, following different networks. So again, it all depends on you. That will determine which one's the best one. These are all great plans out there. It just, again, understand what you're looking for. And one of the things I say, if you do get sick, what is it that you want, right? Because that's when we really know what we're looking for, right? While we're healthy, we don't even know what we have. But when we get sick, that's when we're like, wait a minute, what do you mean I can't go to this facility? Or what do you mean I can't go see this specialist? So again, if you're working with an agent, go over scenarios. Where do you want to go? What hospital you want to go visit? Where, if you were to develop a certain disease, are you going to want to go to, hospital A or travel? Some people are like, no, I'm going to Jacksonville, or no, I'm going to Texas, or I'm going to New York because that's who I trust. So make sure that at least for right now, the plan, especially the Medicare Advantage plan that you choose, that it does give you access, right, to these doctors or facilities. So that's one thing that I recommend that you do. Just investigate, find out, get your education on these Medicare Advantage plans. They're great. You just got to understand them before you enroll in them. Okay. My last question is, I'm 65 this month. Can I get Medicare this month? Okay. So this all depends, right? And I see this a lot, right? I get people that says, oh yeah, I turned 65 yesterday. I want to get on Medicare. No. You want to get your education 6 months prior to your 65th birthday. I used to say 3 months. That's actually when you can you could actually do something. It's 3 months prior to your 65th birthday month. But start getting your education 6 months prior to your 65th birthday. Do not wait until you do not have to wait, because there are people that says, okay, now I can get on Medicare. I'm 65 and a half, or I'm 65. No. That's not when you want to start getting your education, because there's a lot of delays. Okay. Remember, you have to enroll in Medicare before you could even select a supplement or even jump on a Medicare Advantage plan. We need your Medicare effective, and I need that Medicare number, or the agent or whoever you're working with needs that Medicare number in order to enroll you in a specific plan. So don't wait till your 65th month and say, hey, now I want to get on Medicare. I want to get it right now. Doesn't work like that. 3 months prior to your 65th birthday, that's when you, at least 3 months prior, right? You can go ahead and enroll directly with Social Security. You could do it online. You can call them up and set up an appointment. So far, based on what I've seen, appointments are given a month after, I've seen, right now, I had a client call this morning. The next appointment is August 28th. So imagine if your birthday's today, you don't have an appointment with Social Security until next month. Guess what? Your Medicare might not start until 2-3 months after your 65th birthday. And there are people out there that don't have credible coverage, right? And then you have all these penalties if you didn't sign up in time, or you might have lapse of coverage if your coverage ends. So again, don't wait 3 months or 6 months. I have people that call me, they're like, oh, I'm going to be 65 next year. So again, get your education on time. Start learning about Medicare. I'm sure if you call us, especially us, you can call me and say, Myriam, I'm going to be turning 65 next year. What should I do? My advice is start learning about Medicare, original Medicare. Learn about Part A and Part B. Don't be afraid. I have people that are afraid. I have people that stayed on their employer plan because they're afraid to get on Medicare, because I just don't want to deal with it. And then eventually you do. Eventually it's going to end. So get your information, because you might save money. You'll probably get better coverage through Medicare. And that's why it's so important to compare it. And you want to do that 6 to 3 months prior to your 65th birthday. So again, please call me if you have any questions. There's no charge for our services, and no agent should be charging you to evaluate your needs and to give you education and advice on which one's the best plan for you. You can reach us at United Insurance Experts, 561-464-2273. That number again is 561-464-2273. We're located here in Palm Beach County. And again, thank you all for listening, and I hope you all have a lovely weekend. Talk to you next week.
Thanks for listening to Medicare Made Simple with Medicare Myriam right here on Legends 100.3. Medicare Made Simple is brought to you by United Insurance Experts. For more information, call 561-464-CARE. That's 561-464-CARE. Tune in next Saturday at 9 a.m. for more Medicare Made Simple with Medicare Myriam. Are you 65 or turning 65 soon? Then you need to give Medicare expert Myriam and her dream team at United Insurance Experts a call today. They specialize in Medicare and will guide you in making the right choice for your specific needs. One plan doesn't fit all. United Insurance Experts offer you choices: Blue Cross, Humana, Aetna, United Healthcare, and many, many more. Call Myriam at United Insurance Experts at 561-464-CARE. That's 561-464-2273. Medicare can be very confusing. Myriam is here to help. Call Myriam today at 561-464-CARE. That's 561-464-2273. Myriam will educate you with no obligation on your part. Or visit UnitedInsuranceExperts.com. 561-464-CARE or UnitedInsuranceExperts.com. United Insurance Experts is headquartered in Boca Raton and licensed nationally, speaks English, Portuguese, and Spanish.